Are you studying for the USMLE? Are you planning to study for the USMLE in the future? This video is what might just help you to excel in your preps. In this video, I'm going to talk about how I managed to pass the USMLE from a very low score to what I made on my final prep, and also all the resources and like when I plateaued, what I did and what I did getting close to my dedicated and during my dedicated and then the day before the exam. If you are a returning subscriber, you are welcome back to the channel. If you are also someone who just chance on our videos, please take time to subscribe and hit the notification bell so that in the future, when I post any video, you will be the first person to be notified. So let's go straight to the point. Schedule, you must have a schedule. So research shows that people who study according to schedule are able to cover a lot of information, and then they avoid time wasting in their prep, and then they also get very good scores. So you want to get a schedule that works for you. For example, there are a lot of schedules on Google that people have posted that you can also look at it, and you can also decide to edit it to suit your plan for the day. You can be working and still have a very good schedule. I was working 12-hour shift every day, but I was still able to study for the USMLE, and I got a very good grade. The next thing is your environment, the environment that you study in. You want an environment that will maximize your time towards the studies. So you don't want an environment that will be taking away your time. For example, friends, family, other non-academic things that you do, and those things just steal your time. So you don't want that. So also you want an environment that is conducive enough for studies. I studied in the library, which was very helpful to me. I also studied at home, but anytime that I feel that there's going to be a distraction at home, I move out of the house to the library. So think about the environment and plan it to suit you. The resources, let's talk about the resources. You don't want to use too many resources. It's usually UWorld, First Aid, and Pathoma. So this is the Pathoma book here. In my future videos, I'm going to do a video on how to use Pathoma. Also, I have the First Aid. I use the 2019 First Aid. Yeah, there are 2020, 2021, but then when they came out, I felt like, hey, I've done so many annotations in this already, so I don't want to lose all this information that I have annotated. So I just decided to stick to the 2019 version of the First Aid, even though I took my exams in this year, which is 2021. Yeah, so you want to use as little resources as possible. So UWorld, First Aid, and then Pathoma are very, very important. How to use these resources is also very important. It doesn't mean that you shouldn't use AMBOSS, RX, or CO. And CO. Like you have to use AMBOSS and also use RX when you feel like you need it. But then don't do too many resources. Some people will do like all the resources, Kaplan. Yes, it helps, but you want to also narrow, because all these three resources that we just mentioned have all the information you need. You just have to find a way to learn them well, and then you will be good. For example, in the Pathoma, let me just say something small here if I move on. So with the Pathoma, when you're doing Pathoma, you want to, as early as possible in your studies, master the first three chapters of Pathoma. Very, very, very important. So these first three chapters, they have, let's see the topics there. So growth and adaptation, cellular injury and cell death. We have inflammation, inflammatory disorders, and healing, wound healing as the second one, and also the principles of neoplasia as the third one. So you want to master this very well, because most of the exams questions are from the first three chapters of Pathoma. So you want to master it very well in your initial prep. Then when it comes to combining the two, you want to know where to combine it, because some of the topics overlap. 45% of the exams is from pathology. So you want to master this book very well. I watched the videos of Pathoma for like about 5 times, but the first 3 chapters I watched it about 7 times. So you want to do something similar. Um, and then when it comes to the pathology, when I'm doing first aid, usually I use B&B to review first aid because I don't like reading. I'm someone who doesn't like reading, and if you ask my study partner, she'll tell you I never read this book like from cover to cover even once. No, but I've touched everything in the book, but I've never sat down to say I'm reading it like cover to cover. No, I will not do that. So what I do is that I open B&B videos, and then I open the first aid topic, and then when he's teaching the videos, then I'm making my annotations in the first aid, and then I'm reading the first aid along because he teaches according to the first aid, so that helps very much. Then when you get to the pathoma session, B&B does not treat pathology very well. So you want to go, when you get to pathology session, you want to go back to pathoma, and then there are some topics in pathology that were treated best here than here. There are some topics also that were explained better here. Here in the first aid, most of the time they just mention the topics, but the explanation is here. So please combine the two. Don't do this separately and come and do this separately, okay? And that helps. That's one of the things that I did so that I don't have to use 1 month on pathology and pathoma, and then also use 1 month on first aid. Yeah, so that is something that you want to also consider in your studies. Yeah, next is I have this thing I call the pre-NBME rituals. So that's what I do. I have them written here. My pre-NBME rituals. This here they are. So it's always in front of me. What I want to do before every NBME. When my scores were poor in yeah, when I used to score very low in Biostat because I didn't learn Biostat very well when I was in med school. So before that, I'll have to review some Biostat questions. I had to review the first 3 chapters of Pathoma and then some pages in the first aid. So those are my rituals, and also I make sure I review the NVME images, and that was very, very helpful in my studies. Cardiology, so I'll review some the Wigger diagrams because you don't want to miss those. Those are more of pattern recognition. So I review that as well before I review lipid lowering drugs. You don't want to miss question on lipid lowering drugs, and you also don't want to miss question on diabetic drugs. Those two are a must. You must master every single lipid lowering drug and every single diabetic drug and know their mechanism of action and whatever they do. For the lipid lowering drugs, one of the secrets is that if you see increase LDL receptors, hey, go for it. Okay, it's not always so bad. If you see that and then you are not sure of any of the answers, go for LDL receptors, and then that's upregulation of LDL receptors. Yeah, let's come back to what we're talking about. So these are my pre-NBME rituals. So I do the images, NVMe images, of course. I have them on Google Drive. I'll leave them in this video so that you can have access to them. Review them as early as possible in your prep. And before every NVMe, you want to do all these images a day before. And if you do that for about 6-7 times, and then before every NVMe that you take, they are going to stick in your mind. And then in the final step, you will get some questions from those images for sure. Because if for example, somebody has subarachnoid hemorrhage or somebody has epidural hemorrhage, the image is always going to be the same. If it's lens shape, it's lens shape. If it's not lens shape, and then it's let's say it's crescent shape, like it's always going to be crescent shape, you know. So it's not going to change. That's why you have to master those images. Brainstem, very, very important. If you're not good at brainstem, please watch a video on brainstem and practice how to identify the nerves, each of the nerves. You start counting from the top and to the bottom, like you have to, it's a must. You must know. So these are some of my pre-NBME rituals. Next is this one of the most important things, because this exam is testing how, not just how good you are, but how your test taking skills. Because most of us, the score that we get does not define the knowledge that we have. It's just the test taking skills. So you have to find reasons why you get some questions incorrect. For example, is it that your concept on that topic is very poor? Is it that you don't like that subject? And in this exam, you must like every subject. You must have some basic knowledge of every subject. You shouldn't say, I don't like this, so I don't study it. So if there's a particular topic, if it's GI that you are not strong at, you want to work on GI. Take 3 days, 4 days, 1 week to work on GI, because you want to know everything. You don't want to get to the exam and then you are found wanting. So yes. Now, if you are getting questions wrong because you keep changing answers, no, I was doing that at the beginning. So after my UWorld first pass, you realize that I've changed a lot of questions. But then when I did my UWorld second pass, and then I began the third pass, I realized that in the third pass, I changed, after I done like 50% of the UWorld, I had changed only like 21 questions, which is an improvement from I think over 500 change questions in the first pass. So yes, you want to stop changing answers, because changing answers means that you are not sure of what you are doing, and you are not going to do that to patients on the floor. Um, Yes. The next thing that you want to also do is, sorry, the next thing is read questions carefully. For example, if you are getting questions incorrect because of silly mistakes, okay, sometimes the age of the patient changes the diagnosis. Sometimes the patient being a male or a female changes the diagnosis, okay, or to point your attention to a certain diagnosis or a certain area of a way of thinking. And so you want to pay attention your attention to, like, pay attention to these simple details, okay, pay attention to these simple details. And then you must practice how to pay attention to these details, because you realize that the more questions that you do, the more these things come out. Like, you're able to identify what makes you get questions incorrect. So you want to do more questions. People suggest that you do over 7,000 questions. Yes, yeah, I think I did over 10,000 questions. Yeah, so you want to do as much questions as possible and treat every assessment as though it was your final exams. Also, work on your weak areas. Work and revisit those topics. Crucial is taking breaks. You need breaks. Like, we need breaks. Like, but I understand that, like, it's hard. I understand, because, for example, I do work in, like, in the hospital. So I work like 12-hour shift, and then when I come back home, like, I have to, like, study from, I do night shift. So when I get home like 8 o'clock, I have to study from nine, let's say 9 until 12 noon before I can sleep. So and then at the end, I realize that, like, I get fatigued, but then it's hard. So when I started taking breaks, like, I felt better. I felt like I could process things better. My brain is more relaxed. I could retain more information. So you want to do that. This exam, yes, for sure, it is a marathon. It is a marathon. But yes, for example, if you are running cross country, you don't want to run the day before the exams, right? You don't want to run, because you'll get fatigued. So you want to rest the day before. Sorry, the day before the marathon. If you are running cross country, if you are in a competition, and then the day before the marathon, you don't want to run. Because if you run and then you get injured or you get fatigued, you're not going to be able to win the race. So you want to get enough rest before any NBME. It will just be good to have some rest before you prep. You write the NBME. Yeah. So you can get rest in the form of, like, going to gym. Yeah, that may sound awkward, but yeah, going to gym, like, improves blood circulation and also, like, give you that mental rest that you need. You can go out with friends and just hang out for like few minutes, and like, but it should be like, it shouldn't be too long. You can take walks. So I will walk around my apartment complex and then come back and take some shower. Yeah, you have some incentives for yourselves, like also plan breaks and talk to people, like, especially if during your rest, like, you don't want to talk to people who are writing exams, because that is not rest. It means you are still like thinking of the exams. um, but then talk to family, talk to other people that can take your mind away from the exams when you are resting. You need like very good sleep. Sleep is the best thing, but yeah, sleep is very helpful because it rests the mind. See? So sleep, sleep, sleep. Yeah. Always stay positive. Stick to the initial goal, because that helps you to focus on whatever that you set out to do the first day that you decided to go to med school. Yeah, so these are some of the things. I want you to know that, hey, it's doable, because when I got a chance to study for the USMLE. I didn't plan for it though, but then I had to move to the US. So yes, that was the way to go. So when I started studying, like, I was very low in knowledge related to the USMLE. But yes, if I can do it, hey my friend, you can also do it. So I want you to know that, yeah, you can do it. There are a lot of people, like, we just need, like, you don't have to be an average student to pass the USMLE. Once you can sit on your butt and then study, and then repeat and study, and then you can read and understand, hey, I know you can do it. And then once you've been accepted into the med school, hey, you can write the USMLE exams and pass. So yeah, if you have any difficulty, I am here to help. You can text me in the comments bottom. Like, I'll reply. My phone is on my hands. I'll reply when I see your messages. If you want to talk to me personally, also I can leave my email over there. You send me, and then some people talk to me on the phone when we establish that relationship, whereby you can call me and then talk to me. So that is going to be helpful as well. If you have personal questions, you can talk to me. Hey, one more thing. If you are not passing NBME, if you are not getting the pass mark for NBME, do not sit for the steps, please. It is an advice. If you are not getting over the 194, don't go into the exam. Okay. So thank you very much for watching this video. Please take time to subscribe, and I wish you all the very best. And yes, you can also do it. Peace out.